Hey guys, I'll be summarizing the remaining part of chapter 7. So, we're going to be talking about acupuncture, magnetic therapy, and homeopathy. Right, so starting out with acupuncture, it's going to be a traditional Chinese medicine approach. It's going to be dealing with needles being put in points or meridian points within the body. The theory behind this point is that these points help with the energy flow within the body. So, if there's any blockage within one of these points, it could potentially cause pain or any type of disease that's associated with that point. So some of the claims that acupuncture has made that it could help out with, it's going to be with bronchitis, with asthma, carpal tunnel syndrome. It's also made claims that it has helped out patients during the process of rehabilitation after having a stroke. They've made claims about drug addiction, helping out patients with drug addiction, myofascial pain. Sorry. And the last thing about acupuncture is that some of the problems that we could see is that we could give an infection to the patient if we're not using a sterile needle, or we could potentially puncture an organ depending on where we are in the body. The next one's going to be magnetic therapy. So as we know, our founder, D.D. Palmer, he started off as being a magnetic healer. So the concept behind magnetic therapy is similar to the concept of acupuncture, where they're also dealing with meridian points, but instead of needles, they're using magnets, right? So they're using magnets to remove any blockage of the electromagnetic fields that the body creates. So same thing as acupuncture, if there's any blockage within these electromagnetic fields that the magnetic therapy deals with, it's going to create some sort of pain or it's going to create some sort of disease. Right, so some of the claims that magnetic therapy has claimed to help out with is going to be really similar to acupuncture. It's also going to include that it has made claims that it helps out with kidney problems. The practitioner that does magnetic therapy can provide anywhere from necklaces, bracelets, even shoe inserts. I even read, well, the book mentions that there's going to be pillow inserts that one can use to create or to reestablish that proper flow of the electromagnetic fields. Some of the problems that we see with magnetic therapy is going to be the fact that the patient can potentially have an allergic reaction or have an allergy to metals. Patients that have a pacemaker can experience problems with that if the magnet's too close to the pacemaker. And we could even see problems with patients who have an insulin pump that's basically implanted into the patient. The next one is going to be homeopathy. So homeopathy follows the principle of like cures like. What this means is that if something's creating some sort of problem to your body or an allergic reaction, then you got to introduce a small amount of it into your body to be able to cure that problem or that disease that it's creating. So the way homeopathy works, it's going to be with dilution of substances. It's going to be a really small tincture of whatever substance you're trying to help your body accommodate to, if that makes any sense. So, according to homeopathy, when the body or a patient is experiencing some sort of symptoms, such as body aches, allergies, coughing, sneezing, or any type of pain, this just means that the body's trying to heal itself. The FDA considers any homeopathy products as drugs, but they do not regulate any of those products like drugs. So basically, you don't need a prescription. You could just go buy something off the store. You can go with a practitioner that does homeopathy, but the FDA will not regulate those drugs as they would traditionally regulate pharmaceutical drugs. With homeopathy, what they end up doing is that the practitioner has to evaluate the patient's emotional, mental, and physical status, as well as they have to take into consideration their history, personality, and lifestyles in order for them to, in order for the practitioner to be able to give the proper medication or the proper tincture. So some of the claims, according to the book, is that it helps with a bunch of different type of symptoms or disorders. It wasn't specific, but at the same time, Some of the problems that we can see with this, it's going to be that the patient could have an allergic reaction, or the tinctures or the substances that we're using to create these tinctures could have an allergic reaction. Can have a different interaction with other drugs that the patient might be taking currently. So that's going to summarize the remaining part of chapter 7. So next, I'm going to finish up with starting off chapter 8, or basically summarizing the entire chapter 8. So chapter 8 is going to be talking about communicating with a healthcare practitioner. So the first thing that they talked about is that as a patient, you want to be able to select your primary care physician or doctor. So some of the recommendations that they give is that your primary care physician is going to be anywhere from a PA, an MD, nurse practitioner, internal medicine doctor, or even a geriatrician, which is going to be an MD or a medical doctor that mainly focuses on geriatric population. So while you're selecting your primary care physician, you want to make sure your primary care physician has some of the qualities, or they meet the qualities and characteristics that you're looking for in a doctor. This might mean anywhere if you're looking for a doctor to be friendly, kind, funny, straightforward, you want to find a doctor that meets those characteristics. As well as while you're looking for a doctor, you want to ask friends, family, or other doctors or previous primary care physicians for any recommendations on a new doctor. You also want to take into consideration their credentials. You can log into the American Board of Medical Specialties or the American Board of Medical Medicine, and there you will be able to find all the credentials these doctors have, and if their licenses are up to date. And then you also want to make sure that they fall within the insurance that you're within the network of the insurance you're dealing with. The second thing that they recommend is the communication with the new PCP. Right? So before the visit, you want to make sure you're providing all records of your previous medical history, which includes like all your medications, any medical procedures, surgical procedures you've had in your past. You also want to make sure you bring any documentation that you have pertaining to your medical history, and you also want to get ready a list of medication, or bring all the medications that you're currently taking. That also means any vitamins, supplements, over-the-counter, or prescription medication that you've been taking. During the visit, you want to make sure you tell the patient, that you tell the doctor or the staff of any type of hearing, speech, or vision problems that you might have, because this might dictate how your first visit goes, or how every single visit you have with the doctor goes. You want to make sure that you're well aware that during these visits, sensitive questions on sensitive topics might come about, such as your sexual health, sexual practices, if the patient has any sort of hearing problems, bladder problems, or any sort of balance problems. You also want to consider the fact about bringing in a family member, or having a family member come in with that patient during the visit. This could help out because it could have better communication between the patient and doctor, or it could also get in the way of how honest the patient is being with the doctor, because he doesn't feel comfortable with that family member being there on certain things, or certain things the patient wants to talk to the doctor about. Lastly, communication during subsequent visits. So once you have established your first visit, what you want to make sure is that before any visit, you write down a list of any new concerns, or any new documentation, or any new lifestyle changes that has occurred during the time of your first visit onto your follow-up visit. You also want to update the doctor on any, or the staff on any type of new treatment that you started, or anything else that you started aside from what the doctor recommended from you. During the visit, you want to make sure you keep honest communication with the doctor. You want to discuss any problems that you had with the first interaction that you had with the patient, anything that you like or dislike with the doctor, as well as you want to bring up new concerns or any new questions that you had that you weren't able to get out of the way on your first visit. Lastly, after your visit, you don't want to bring, or once you're wrapping up your your subsequent visit or your follow-up visits, you don't want to bring up any new concerns, right? So this might be really hectic with the doctor because you've already established everything you talked about, and then you bring in something new that he has to reanalyze or rethink something that could potentially change whatever you guys already discussed. And lastly, you want to be able to make sure you summarize or you kind of just run through everything you guys talked to together. And that's about it, guys.